Hello and welcome to Health Afrik on AAU TV. AAU TV is the voice of higher education in Africa, and Health Afrik is your favorite health show on television today. My name is Bridget Amadente. Today we are continuing with our dentistry session or dentistry series, and I'm here with Dr. Olivera Emma. She is a specialist dental surgeon. Today we are discussing oral health in Africa, bad breath and stained teeth. We are all victims, my dear. We are all victims. You never know what exactly is going on in your mouth in there, so you have to listen to the conversation and learn a lot. But then the WHO says that 3.5 billion people suffer from oral health, a lot of other things, and then like a majority of people have dental caries and dental cavities and all of that. That is what we discussed last week, and I know you enjoyed the conversation. We are continuing today. Please stay tuned. I'll be back shortly and then we can get the conversation started. Do stay tuned. You're welcome back from the break. This is still Health Afrik on AAU TV, discussing oral health in Africa, bad breath and stained teeth, with Dr. Olivera Emma. She's a very nice person. I love her so much. You're welcome, Doc.
Thank you so much.
It's a pleasure to have you here again.
Oh, likewise.
Okay, so today we are discussing oral health in Africa. Stained teeth, bad breath, and all of that. But then I want to ask, what is oral health? And then what are the factors that make up oral health?
Okay, so basically, oral health is having an optimum oral cavity. Okay. And interestingly, there's a direct correlation between your general well-being and then your oral health. Exactly. Remember, everything that you eat passes through the mouth into your body. So it's crucial to make sure that your oral cavity is in optimum health at all times. Okay. Okay. Now, factors that influence your oral health: your nutrition, diet, your dental history, your medical history, and your social status. Okay. Now, when it comes to your nutrition and diet, when you take in high consumptions or when you have high consumptions of sugary foods, it affects your dental health. Okay, you tend to have a lot of cavities. And then also it affects your gum. Another thing is that when you don't visit the dentist frequently, it's recommended to see the dentist at least twice yearly, so that in case there's an issue, it can be picked up, solved before it becomes worse. Okay. So dental history also plays an essential role in your overall oral health. Okay. Another factor is your medical history. Now, certain diseases like autoimmune diseases or systemic conditions like diabetes, when it's uncontrolled, it affects your gum. Okay. So it affects your periodontal health. Another thing, infectious diseases. So certain infectious diseases like HIV, for instance, manifest in the oral cavity also. Yes. Wow. And then so you can look in your mouth and it tells us a lot of stories. So we look in your mouth and we already know what you have. Wow. Yes. And then also autoimmune diseases like systemic lupus erythematosus, lichen planus, they all have manifestations in the mouth. Wow. And then when it comes to your social status, poor illiteracy levels, also when it comes to, high intake of alcohol and tobacco, they all affect the oral health. They have detrimental effects on the oral health. So it's essential to make sure that you take care of it at all times. Okay. But then at the mention of visiting the dentist regularly, but then there's a lot of statistics out there saying that there are not enough dentists, and then there's a lot of information also there that says that people are not really aware of their dental health. Like they think like your teeth, you just eat and then you're going and you're coming, like that's just it. So I think there should be a balance with regards to dental health. Dentists, availability of dentists, and then awareness creation. Definitely. Because I think the last statistics I saw in Nigeria alone, one dentist to 150,000 people. I'm wondering how can one dentist take care of all these people? Yeah, but then we also have instances where dentists talk about the fact that people
people don't even come in.
Sure.
So what's the playground here? What's the middle ground here?
So over here, interestingly, a lot of people come to us when they're in extreme pain, when there's nothing else they could do. Because what I've noticed is that on the Ghanaian market, we have all sorts of concoctions to take care of, pain, dental pain. People sell things on the market, in vehicles, and most of them are not even approved by FDA.
Wow.
So a lot of people try to solve the problem at home before they come to us. So by the time they come to us, things have gotten worse. And then people also associate dentistry to extraction of teeth. So when they come, they only want you to take out their teeth. They come and they're like, oh, doctor, I want you to remove my teeth. And I'm like, no. These days, there are several things that we can do to preserve your teeth as much as possible. Extraction is always the last course, because once you take out the teeth, it's very difficult to replace it. Besides it's being costly, you don't have your natural teeth back. You can only use artificial means to replace it. So it's always best to preserve your natural teeth as much as you can.
Okay, and to talk of artificial teeth, can you still chew meat? If it's your front teeth, how are you going to bite? Or it's easy to still use your artificial teeth?
Okay, so there are different types of replacements of teeth. We have the fixed options, the removable options, and the implants. And interestingly, they all have the advantages and disadvantages. When it comes to removable options, the disadvantage of the removable option is that you have to be removing it every now and then, especially when you go into bed. But you can eat with it, you can chew with it, you can laugh with it, you can do whatever you want to do with it. It's interesting. You can do whatever you want to do with it. The only time you take it off is when you're going to bed. And then when it comes to the fixed options, the advantage is that you don't have to take them off at all. They are fixed in the mouth and you keep them there. The disadvantage to some extent is that sometimes you would have to use the adjacent teeth to replace what you don't have. So we'll modify them a little bit to be able to replace them. And then we have the implants. The disadvantage of the implants is the cost. It ranges from about 10,000 Ghana cedis per tooth.
Wow.
Yeah, dentistry is expensive. So basically that is it.
Okay. And then in the beginning you mentioned the fact that everything that you eat or whatever condition is going on in your body reflects in your mouth. Let's look at the relation between non-communicable diseases and then oral health. People who smoke, tobacco, like alcohol and all of that. Please take us through that.
Okay. So when it comes to high consumption of tobacco, it has detrimental effects on the gum, on what we call the periodontal ligaments. So the periodontal ligaments are what actually holds the tooth in the bone. The tooth has two parts, the part that we see, and there's a part in the bone covered by the gum that we don't see. So the periodontal ligament holds the part in the bone together. Now, when you take in high tobacco, it tends to affect the periodontal ligaments. They become very weak. And then if care is not taken, the teeth start becoming mobile and they can even fall off. Another thing is that it can cause erosion of the teeth, that is, the teeth can wear down. And then lastly, it can even cause malignant lesions like cancers. So you can have oral cancers forming as a result of the high intake of tobacco. Now with the alcohol, it's so bad, it's also detrimental. It also causes tooth erosion. And then also dental caries. You can have dental decay as a result of high alcohol intake. And it also affects the periodontal health. But also when you are intoxicated, you lose control. So you can have facial injuries and then dental trauma. Easily fall off, the teeth gets broken, it gets fractured. And then even the face and then part of the head as well. So there is a direct link between that.
That means we should really stop the drinking.
You have
all
to
exactly.
Tobacco and alcohol should be avoided if possible.
And even sugar.
Exactly. Sugar should be avoided as well, as much as you can, because it's not only bad for the oral health, but for your general well-being. Yes.
Okay. We are going on a break. When we come back from the break, you will see Dr. SL. Please stay tuned. You're welcome back from the break. This is still Health Afrik on AAU TV, discussing oral health in Africa, bad breath and stained teeth. We are moving to bad breath and stained teeth. Dr. Essel, you're welcome.
Thank you so much.
It's a pleasure to have you here again today.
Thank you.
Okay. Before we go to bad breath and stained teeth, I want you to tell us, what is the general behavior of Ghanaians towards visiting the dentist, coming to the dentist for like a general checkup, and what is the general perception of people about dentistry?
Okay, all right, thank you. Well, I can say that it's better as compared to a decade ago.
Okay.
But we are still seeing cases who present with pain. So if there's a cavity, they don't usually come. They manage whatever it is till they can't take the pain anymore. But it's getting better. People working routinely for just checkup and then cleaning. What we usually advise is that you visit your dentist at least once, twice a year, once every 6 months. But it's getting better. Generally, it's okay. It's not the best, but yeah, it's getting better. We are getting there.
Okay.
As the education keeps going on. People
and then in some like some public hospitals, you hear that the dentistry session or the dental clinic is at the back. Like, it's the last thing you see. Even if you go to the hospital, like, it's the last thing you see. So your mind won't even go to. Is it that we have sidelined it, or people just don't know about it?
Well, it's a bit of both. Okay. It's a bit of both. Dentists are not a lot in Ghana. Basically, we are not a lot, and people don't really pay particular attention to it unless there's an issue. So that's also sort of relegated us to the background. The policies that they make, they build the facilities before they remember that, oh, you also need dental facilities. So in the end, it will be like an auxiliary something. To be at the back. We are not really in the forefront. Like, generally that's how it is. Even for human beings, they don't really pay particular attention to. If there's a headache, they'll pay attention. If there's a cut, but if it's something in the mouth that he can close his mouth and then hide, and now with the face mask, they won't really. So basically, that's it. The policies are not really in our favor. But as I said, it's getting there. It's getting there. Lots of private clinics are also coming up. So
okay. Let's move to stained teeth. What will cause your teeth to get stained?
Okay, so basically with the staining of teeth, we have two types generally. We have the intrinsic one and you have the extrinsic one. Extrinsic is like it's on the surface of the tooth itself, so you can easily take it off. Like probably when you eat something, maybe sobolo or something, your teeth get stained. After a while, you wash it out, you brush it, and it goes. But we have intrinsic staining of teeth also. That one, it's embedded in the tissue of the tooth itself. So that one usually it's caused by mainly our diets, and then probably medicines. One of the medicines that usually causes these things are tetracycline, especially when a pregnant mother takes in tetracycline when she's pregnant. It affects the baby's teeth. So that one, it gives them very yellow teeth. Some medications, especially tetracycline. Our oral habits also can also cause. But generally, let me just say this: the normal adult human teeth is not snow white. It's not as white as snow. It has this off-whitish, ivory colored sort of thing. It's a spectrum. It shouldn't be as white as. So some people come that their teeth are stained, but when you look at it, it's okay. Basically, that's it. As I said, we have extrinsic and we have the intrinsic staining of teeth.
So with stained teeth, how would you like correct it?
How would you? It depends. It depends. Some people really like to have the white teeth. So if you come and then you want the white teeth, we have options for you. We can do the whitening for you. But if it's not that bad, we also do cleaning. So we really advocate for the cleaning. Once every 6 months, you come for cleaning to remove all the plaque accumulation, all the stains from around your teeth. Coffee can also cause stains. That one you don't need to do whitening to do. You can just do cleaning and then we can do that one for you also. So we have various treatment options: the whitening and then the cleaning. Usually most people prefer the cleaning as to the whitening, but the whitening also getting a bit of market. It's becoming a trend now these days.
Okay. But then if a woman is pregnant and as she said, she takes what? Tetracycline. Okay. And then the baby is born. The baby has yellow teeth naturally. What can be done about it? Okay,
so for that one, for instance, let me just say this: tetracycline, they've stopped giving it to pregnant women. But sometimes, our society, you can just walk in and then purchase it from a pharmacy. But usually we don't give it to pregnant women. But should it happen, we have options. We can do veneering for the child. That means we will coat it with a filling material. We will coat the surface with the filling material. We can also do bleaching for the child. So there are several options depending on how severe the staining is. So veneering is there, either with composite or with an actual crown or something. Okay. And we can also bleach the teeth for the patient.
Okay, let's move to bad breath.
Okay.
I mean, with using a nose mask, you know, you will smell it yourself, so you know that something is going on in there. What will cause bad breath? Okay,
so bad breath, basically it's microorganisms that cause bad breath. We can't really do away with the microorganisms in our mouth. So there are several causes. Number one, poor oral hygiene. Okay, well, let me just categorize this into two. We have the ones which come from the mouth, the bad breath, and then we have one which comes from the body itself through the nose, and then the nasal passages. Yeah, so we have two types basically, but most of the halitosis, most of the mouth odor comes from the mouth, about 85%. So if there's something going on in your stomach or something, it can also manifest as a bit of bad breath. Yeah. Okay. So those are the two main types. But the oral cavity is basically plaque accumulation. Plaque accumulation can cause it if there's a tooth decay going on. If something is decaying and it doesn't smell so good. If you have a bit of inflamed gums also, you get a bit of bad breath. Yeah. So basically that's it.
But then you talked about something from the nose. I mean, how does the nose and the mouth?
Oh, they are connected. They are
connected, but how does it?
So in order for us, usually, that's what I'm saying, it's a broad category. In order for us to differentiate whether the bad breath is from your nose or is from your mouth, we try to differentiate. So we smell what's coming from your nose, and then we smell what's coming from your mouth. The one which comes from the nose is a bit different from the one that comes from. Yeah, it's not easy. Yeah, so basically that's it. Yeah, if there's something going on in your stomach also, it can also manifest as a bit of bad breath. Yeah. Some cancers, it's not localized like that. It's a whole spectrum of things.
Okay, so how do you treat it then?
Okay, so the one you treat the cause.
You treat the cause.
You treat the cause.
Okay, so if it's coming from the stomach or something, you start it from there.
Probably, yeah. If the person has a bit of gastric reflux, that the patient sort of brings in the stomach contents from the stomach into the mouth, you need to sort of deal with that one, and that will help it. But as I said, most of the bad breath is caused by something going on in the mouth. That's the major culprit. So we will do cleaning. If everything is fine, your gums are healthy, everything is fine, then we go to the tongue. So intraoral too, the major culprit is the tongue. People brush their teeth very well, but they don't clean their tongue. And the tongue is beefy, it's meaty, it has some furrows and things inside. So microbes easily get into the tongue, and that also causes a bit of bad breath. Yeah. So basically it's the tongue. So if you don't take care of, but as I said, generally we need to localize the cause and then we'll deal with it. Yeah. So if there's a decay, we take the tooth out. If there's plaque accumulation, we do the scaling and polishing. If your tongue is, we clean the tongue for you. Basically that's what we do.
Okay. So over the week, I mean, I was at home and then something happened. My dad and I, we just crashed like that. I don't know how it happened. So my teeth hit his head. So all of a sudden I was like, God, why? I'm on TV talking about dentistry and this has happened. At that moment, I didn't know what to do. But then I was feeling some kind of pain. I was discomfort and all of that. So I'm like, okay, so what is the first aid option for someone who has hit his or her teeth against something? For maybe it has chipped off or it has come out, that kind of a thing. First aid process. Please take us through.
Okay, so that one, it depends if it's a child or an adult. Usually if it's a child, maybe say 7 years, the adult teeth, the front one just came into the mouth and it's chipped off or it's come off about completely. We have options where we treat them. So for instance, for children like that, the root has not really fused properly. The tooth has not formed properly. So we need to sort of maintain, treat it so that it doesn't progress as such. But for an adult, if there's a chip or the tooth has come out completely, as an example, if the tooth has come out completely for an adult, we can put the tooth back. But for a child, if it has come out or the tooth, something has happened to it, we can easily put it back. But that would mean that you need to store the tooth in a medium. For example, he was playing and then he fell and then the whole tooth came out. You take the tooth, you wash it under running water, and then you get a bit of salt water, and then you put it in and then go to the dentist within 30 minutes. Yeah, within 30 minutes. It helps us sort of save the tooth, because the ligaments around the roots will dry off or they will desiccate in a few minutes. So you need to keep it say, usually we have a lot of mediums. We have the milk, we have the salt water, and we have the saliva itself. Sometimes, even though this is risky, they even put the tooth itself in the patient's mouth like that, so that at least it's in the same oral environment as it was, so that
you don't swallow it too.
So the danger is that they might swallow it. So we get a cup, and then we let them spit into the cup, and then put the whole tooth in it, and then go to the dentist as soon as possible. You can also get milk. The thing is, once you delay, the microbes, the ligaments, it's sort of drying off, and it's making it much more difficult for us to put back. Okay, so let's go to an adult. An adult has a chipped tooth. He might experience a bit of pain, but which will wear off. But the thing is, once the enamel is broken, the dentine is exposed, the pulp is exposed, it will not happen suddenly, but after a while you start experiencing pain. The tooth might also discolor because the pulp is involved. So once that happens, it's not a sudden something. It takes a while before the tooth eventually dies, because it's been exposed to a bit of bacteria. There's no protection for the tooth, so that has happened. So once it happens, you need to come, so that at least, even if it's a filling, the tooth that has shipped off, we just do a filling on top to protect the tooth from bacteria ingress into the tooth. If there's anything, even if it has hit something, it hasn't chipped off or anything, you can also come around. Let's just see, and then we'll see what we can do for you, depending on how you present.
In the time that maybe you are driving to the dentist, please, what can you do?
For
maybe your teeth has hit someone, it didn't fall off, like it didn't chip.
So first off, you can take a painkiller which works for you, and then come to the facility. That's the first aid we can do for you. Dentistry is more practical, so you can't really do much for yourself at home. So you just take a painkiller, let the pain come down, and then visit your nearest dental facility. Let us see what we'll take X-rays, do some investigations, and then we'll see what exactly.
But then there are some, should I call them medicines or drugs, or Dr. Emma will say concoctions they sell on the market, that they say, okay, when you're having pain, just put it under your teeth or something like that. If you have like an issue like I did, and then I decide to, okay, let me just put it on my teeth till I get to the dentist place. Is it advisable, or I should use, in my case, I use salt water. I don't know, that's what my dad told me to do, so I did it.
Okay, so the salt water is advisable, but you see, usually the ones that they sell on the Ghanaian market, the herbal preparations, all those things, they are actually more detrimental to your health than, they cause more harm than good. Yeah, basically they cause, because the way the tooth is structured, then there's no medication that you can put there. There's nothing that you can do there, put there to sort of build the tooth back. I don't know if you get what I
I get it.
You can't do anything about it unless we actually see and then we do a filling or something. So they sell a lot of these medications around that when you just push it there, usually these things, they sort of irritate the mucosa, the gum tissues around us. So patients will come in and the whole place is sort of inflamed, the whole place is very red, and they put touch and go there, they put a lot of these things, and they are causing more harm. So even though you presented with, you've also given yourself another, because you didn't want to come to the dental clinic, and eventually you bought, they'll say that they are saving costs, but you bought this herbal thing, you bought this, you did this, eventually you still came back to us. So that's what I'm saying, that usually just take your painkiller and then just come and then let's assess you. If there's a filling we need to do, fine. If there's no need for us to do a filling, we'll just put you on medications for a while, and then we'll keep observing to see whether something has happened to the tooth or everything is fine, then that's all.
Okay, but then the chipped tooth, when you're coming to the dentist, will they be able to fix it?
Oh yes, so for the chipped tooth we can easily do it. If sometimes when we do it and then the filling keeps failing, like it means it keeps coming off, we can put a crown on top of it to cover the tooth completely. Oh, okay. Yeah, so there are several options available. It's not like when you come, we will take out the tooth. There are several options available. And when we do it, you wouldn't even notice that it's an artificial something that's there.
Okay. What will cause your gum to inflame?
To get inflamed. Number one cause is plaque. The debris, the dirt from the microorganisms in your mouth. That's the number one cause. Sometimes too, maybe you take in a very hot substance, hot food, something that's scalds your gum. Yeah, that could also. But the number one cause is the plaque accumulation from poor oral hygiene. So if you're not brushing your teeth properly, the likelihood of you getting inflamed gums are very high. And then that will manifest by when you brush your teeth, you see bleeding because the gums are already inflamed. So any slight provocation, they bleed. Yeah. So that's the number one cause of inflamed gums and then bleeding gums.
Okay. So that's what the cleaning is for.
Yes. So once we clean it, the gums will heal, and then you won't get the bleeding gums anymore. You won't get the bad breath.
Kindly take us through some of the services you offer here at Allsmiles.
Okay.
And then we can go do practicals.
Okay. So at Allsmiles Dental Clinic, we are a dental clinic located at Osu for this branch, and then we have another branch at Dansuman also. We do everything dentistry. So any problem that you have, we do cleanings, we do whitening, we do fillings, we do root canals, we do implants, we do crowns, we do bridges, anything at all.
Right.
Yeah. You want to know what a bridge is?
Yes, I do.
Yeah. So a bridge is like when you lose a tooth, for instance. So we sort of bridge the gap.
Okay.
So we will put. I don't know how to say it. We are sort of closing the gap.
Okay.
So we will put a filling on, not say a filling, like a crown on one side, adjacent to where you lost your teeth, and then another one, so that we can put the replacement in them. So in the end, it becomes like a bridge. So we are connecting one side to another.
Interesting. I see.
Yeah.
Okay.
So those are the and more. We do more also.
Okay. All right. Thank you so much. Thank you so much for staying tuned. This has been Health Afrik. We are going on to do practicals on teeth cleaning, so please stay tuned as we go in there.
So I'm just examining our client here. She's walked in for routine checkup, so we'll just take a look if there's anything wrong with it. Okay. All right, ma'am, please open your mouth. All right. Okay, please put your teeth together for me. Bite at the back. Back teeth touches. Just open wide open. Okay, lift your tongue. Alright. So just a bit of you can relax. So just a bit of plaque accumulation around. Yeah. So we recommend cleaning for you. There's a little cavity developing around the side, so we need to restore that one also for you. Basically that's just it. Yeah. So you want us to do the cleaning for you, right? Yes, so we'll go ahead and then we'll do the cleaning for her. That's like some vibrations around the teeth. Just a scalar stretch. Vibrate and brings out a bit of water. So it's going to vibrate around the teeth. After that, it's a little bit uncomfortable. I shouldn't be painful. Once you're in, kindly let me know. Please open wide. Okay, we're going to start. Okay. Usually, down to when we do the cleaning and polishing first, the plaque has become so hard that it's sort of attached to the gum. So once we take it off, the gum will transient to it. It's not like something that's going to be there for a long time. Transient to the remove. I mean the bleed. As we remove them. So basically that's it. As I said, it's the plaque accumulation that causes the gum to be inflamed. Once attached with the steel access, the place is already inflamed. It starts bleeding. And also some medical conditions also give us a bit of spontaneous gum bleeding. And we have sometimes when you have a bit of cancer, an oral cancer can also give you bleeding. If there's a localized lesion around that side, maybe there's a caries assisted with the tooth, and then there's a swelling associated. It's spontaneously bleed also. And some medical conditions like leukemia also do that. A bit of gum inflammation, and then that also will lead to some bleeding. There are several factors that affect the blood. Sometimes for a normal tooth, if you are brushing too hard, with a very hard toothbrush and you brush too hard, the gum will also bleed, the tongue will also bleed. So those are causes of bleeding also. One thing about the filling and polishing is because our instruments vibrate around the teeth, it sort of gives a bit of sinking sensation around, so it's not very comfortable. It's a bit because you have this instrument vibrating around it. But that's the only drawback about it. Aside that, and usually for first time visitors, it's much more uncomfortable as compared to someone who is in lower uniform. Your body gets acclimatized to it. One thing we also notice is that usually for us, most of us, we brush, we brush the front surface of our teeth, and then most of the plaque accumulation goes to where the tongue touches the tooth. That side, that's where most of the plaque accumulation is. Naturally, it's because there's a lot of saliva around that side, so there's calcium in our saliva. It hardens the plaque easily as compared to the front. But sometimes you are brushing the front surface of our teeth where people can see. That side, because that's what people can see. That's what you can actually see. So most of the plaque accumulation is hidden here, but it's still there. It can also cause the same damage that it causes. So right now we are just going to do a little bit of polishing for our client here. That's how it feels. Right. As I said, it's transient, so it will go. Okay, it's transient. Sometimes it's going to happen after a while. Please open your mouth. So this is we call it prophylactic teeth. So it's like a toothpaste, but it's a bit rougher than what we usually use, like the close-up and stuff. This is a bit rougher. This has much more abrasive qualities. So it's please bring the camera up. So with the profi paste, it's, as I said, it's rougher. It gives us that much more polishing strength. That's what it has. So it's not recommended that you use it every day because it might wear away the teeth. So once every 6 months, you just come and then we use it for you. Basically, that's it. It gives us the shine, it smoothens the surface of the teeth to prevent plaque accumulation from coming onto the teeth. Basically, that's it. So that's what we do. We do the scaling. That's what the scale has it. And then the polishing with the prophylactic space around the teeth. And then the tongue also be cleaned down. So basically, that's just a session of the year. So that's for 6 months, and then 6 months later, she comes again for another session. So basically, that's it.
You can see she's using some pink like water to wash her mouth. What's the name?
Okay, so it's a fluoride tablet. Yeah, so it just fluoride sort of keeps the teeth strong. Fluoride makes the teeth strong, so we put them in so that And it's sort of, basically it's just fluoride that we let them use to clean their mouth, to rinse their mouth. Okay. It's also flavored, so instead of using the normal water, flavored.
So our client says to tell us what she's feeling in her mouth.
My teeth feels clean, is one. Yeah. Feels very neat and freer inside. Yeah. It's not sensitive at all. Oh. It's just uncomfortable in the beginning, but after that it's fine. I'm feeling okay. Come and do your cleaning here. Teeth whitening, all the dental procedures. We do it all here at Allsmiles Dental. See you soon.